Hi, my name is Dr. Claire Clabby. I'm one of the milk quality advisors in Arabon, along with Ronan and Paddy. So I've recently joined Arabon, and before this I was working in Chagasmore Park and we did a lot of research into selective dry cow treatment. So this video today is looking at how can we implement selective dry cow if our herd is suitable for it, and then some general tips on drying off cows as well. So just to begin with a small bit of background, what is somatic cell count? So somatic cell count is an indicator of mastitis in your cows. It's a measure of the white blood cells in the milk. So the more white blood cells there is present, it indicates the immune system has turned on and is trying to fight an infection. So typically 200,000 cells per mil is our cutoff point. So anything under this is considered healthy, and anything over 200,000 then is considered there could be potentially a subclinical infection there. So our selective dry cow treatment then, what's that? So this is where we treat only that cows that have an infection or are very likely to have an infection with antibiotic dry cow tubes. The remaining cows are dried off with a teat seal alone, so they get no antibiotics. So why are we looking at this then? In January of 2022, EU regulation came into effect which prohibits the preventative use of antibiotics in groups of animals. So from a drying off point of view, maybe not every cow needs a dry cow antibiotic tube. That potentially there is some cows that don't require an antibiotic and that they just get a sealer only. So I suppose we don't want to be giving antibiotics to an animal that we think might get sick or might get an infection. We only want to treat the animals that have an infection, and the other animals we don't want to be building up resistance to our antibiotic tubes. So our antibiotic use then in dairy herds, just looking at the dry cow tubes, so 95% of cows in 2019 were dried off with antibiotic tubes, so that's of the country. So if we are going to look at selective dry cow treatment, first of all, we have to consider, is our herd suitable for it? So we have two criteria here that we want to meet before we consider going any further. So the first thing is our bull tank cell count. So are we consistently under 200,000 for the last year, for the last 9 or 10 months? So as I said, that consistently under, so we don't want to be rising and falling and rising again with our cell count. While it might average out as low, we kind of want to have cell count kind of fairly steady all year, that's not rising and falling. The second point then we want to look at is milk recording. So if we have 3 or 4 milk recording done already this year, that's great. If we don't, could we look at getting a milk recording done before we dry off the cows? So if we can answer yes to all of those questions, then we can look at what cows are suitable then for teat sealing. If we don't meet those two criteria, selective dry cow isn't for you this year. So maybe you could look at next year putting things in place, either getting our cell count down or maybe looking at milk recording, maybe have to freeze brand the cows before you go milk recording. So those kind of things we can put into place next year to be ready for it then. So we have decided we're going to go with selective dry cow. So what cows are suitable? Again, not every cow is going to be suitable for teat sealant alone. There is going to be cows that do require an antibiotic tubes, and those cows should get those tubes. So how do we differentiate between those? So our first thing then is our milk recording. So if we have done 3 or 4 milk recordings in the year, which one is the best? So the best milk recording to pick out your cows is your last one. So ideally, if we could get the last milk recording done 30 days before they're dried off, or as close to as possible. I know it mightn't always be achievable with getting lads in and all the rest, but as close to as possible as drying off. So again, if you haven't done any milk recording this year, could you get one in before they're drying off? That is very good for picking out which cows are suitable or not for your drying off. So we have our milk recording results. What cell count then should we pick out our cows on? So ideally we want to pick out our lowest cell count cows. So if this is our first year trying out selective dry cow, I would not go over 65,000. So the lower the cell count, the better. And and keep it low. If you have done selective dry cow for a few years, maybe 2 or 3 years, this might be your third year going into it, and you found it worked well, you could maybe push it out a small bit, but at the same time, I would not be going over 100,000 cells for TTL only cows. So there are first two criteria. So our last milk recording and under 65,000 cell count. Okay, there's another few factors then that play a big role in the success of using TTL alone. So the first one, and I suppose this is probably the biggest one, is our milk yield at drying off. So a lower milk yield at drying off when using TTL only in cows, you're more likely to have a lower cell count when she calves down than the following spring. So if we look at this graph here, this yellow line is our TTL cows, the blue line are cows that got antibiotic. So along the bottom is the milk yield at the last milk recording before cows are dried off. So you can see here this goes from 11 litres per day up to 20 litres per day. So you can see cows that are dried off at TTL, their cell count the following year, the following spring, they were calving down at 50,000 cell count when they had a milk yield at 11 litres per day when they were dried off. So cows with a higher yield per day up at 20 litres here before they were dried off, they had a way higher cell count then that following spring when they calved down. So restricting your feed before drying off your cows with your TTL cows is fierce important. So yeah, restricting your feeding, it's going to have a massive impact on whether that TTL is successful or not. So why the high yielding cows, it doesn't work as well. So when you dry her off, there's still a lot of milk inside in the udder, and that puts a lot of pressure on the TTL, and it's just not as effective as if she has a lower yield. There's less pressure on the udder. So that's what's happening there. Second thing then to look at is the age of our cows, or cow's lactation. So these are results from a study. There's about 2,000 cows in this study across Ireland. So we looked at the percentage of infections in each group of cows. So our first lactation cows, second, all up to our fifth lactation. So you can see here our second and third lactation had the lowest proportion of infection compared to any other group of cows. So that was quite surprising. You see here our first lactation cows, they're quite high. That was not what we expected at all. So you imagine your first lactation cows, they're young, fit and healthy cows. They have no wear and tear. It's their first year milking. You should imagine that they should be down here the lowest group of cows with infection. And in fact, they're actually higher than our older cows in the herd. So quite concerning. At the minute, we don't really have an answer for why that is. So it is, I suppose, something to look at if you are having a lot of heifers calving down with mastitis, to maybe avoid that group for TTL only, and look at your second and third lactation cows for the TTL only. So the next thing to look at then is the length of the dry period. So we found that cows with a longer dry period were more likely to have a higher cell count after calving if they were dried off with a TTL only. So I suppose the average dry period length is probably 60 or 80 days. So our longer dry periods, we're talking about over 120 days dry. So they're more likely to be your late calving cows, April, May, or after that if possible. So if we could maybe look at our scanning results and try and pick our cows that are going to calve down early, that are going to have a relatively short dry period, 60 or 80 days, that's probably going to have your best outcome for the following year. And then again, as I kind of said earlier, your cell count at your last milk recording. So the higher your cell count that you pick up when she's dried off, the higher she's more likely to have a higher cell count when she calves down. So if we could try and keep the cell count as low as possible for the cows that get TTL only. And finally, then we've picked the right cow. Her yield has been low. She's a low cell count, and she's going to have a relatively short dry period, 60 or 80 days. Then it comes to the housing. I suppose this is where you need to have a lot of attention if you're going to use teat seal only. So twice per day cleaning of the cubicles are associated with a lower cell count at calving when using teat seal compared to once a day. So I suppose ideally we want to have this kind of scenario on the left hand side, and try to avoid this on the right. Now I suppose you could say the one on the left are just after being done, the one on the right they need to be done, but I suppose if we can try and keep it as much to as clean as possible, so running our scrapers every 3 to 4 hours, keeping the cubicles clean, so that reduces the risk of them picking up a new infection. So what our antibiotic tube does is it kills any infection that she might have already, but it also prevents her picking up any new infections over the dry period. So a teat sealer will only close off the teat end. It won't kill any infection, and if she's lying down in dirt all the time, she's more likely to pick up a new infection. So as you can see, the risk then of when is she most likely to get an infection over the dry period. So I suppose there's two key time points of when she's most likely to get an infection. So here, day 0, this is when she's dried off. So the highest risk is the first 2 weeks after she's dried off. So this is where the elder is shutting down, the cells are resting and repairing, and you see yourself, the udder is reducing and shriveling up, we would say, in size. So while that process is happening, while it's transitioning from that milking phase to not milking phase, it's a high risk of picking up an infection. So once she stopped milking and the udder has shut down, we'll say closed down for the winter, that's a very low risk of infection. And then once she starts springing up again, the 2 weeks before she calves, so if she calves down there, day 60, we'll say, where that yellow line is, then that 2 weeks beforehand, where the system is getting ready to start milking again, that's when she's again high risk of picking up a new infection. So I suppose at them 2 time points is really when you want to look at your housing and keeping the cubicles clean as possible. So as I said, if this is your first time going at selective dry cows, go small. So with your lowest cell count, even if you only go with 5 or 10 cows, and see how they go. Every farm is different, so what works well on your farm mightn't work well for another farm, but you don't really know until you try it out. So that's why go with small numbers for your first year, do them well, and see how you go after that. Then the next year, if things go well, you can try and be a bit braver, I suppose. So I just want to show you how there can be such variability between herds. So this was a study done back in 2015. So we actually had used a cutoff point of 200,000, which I don't recommend. That's just what we tried at the time. But you can see here, we say for herd 2, these teat seal cows, again in the yellow, so they calved down the following spring, and their cell count was averaging at 220, which is quite high. We could basically say that teat seal wasn't a success there. However, on herd 4, you can see these teat seal cows, again in the yellow, they calved down the following spring, 69,000 cell count. Now on paper, these 2 herds looked the exact same. They had their bull tank was well under 200,000 for the year before. They had regular milk recordings, and that, so it was just, and they had a similar number percentage of cows dried off with teat seal in each herd. So there is, between herds, there is factors that's going to play, and you just don't know what they are until you try it out, I suppose. So proceed with caution. So then just drying off in general, just a few points on that. So prepare for drying off. What do we need? So we need our tubes, our sealer tubes, or our antibiotic tubes, if we're going to use them, our cotton wool, our surgical spirits, or methylated spirits either. So if we you can get the cotton wool. They can come in these little balls, which are handy, that you just you put them into a bag, put this methylated or surgical spirits into it on top of it, and you're ready to go. You can get the roll of cotton wool. You do have to tear it up then, which could be another job for you, or not. So then our gloves then, make sure we have gloves, that we're regularly changing our gloves between each cow. If possible, definitely after each row. You don't need to be cleaning your gloves, and you can also use the cotton wool soaked in methylated spirits to clean your gloves. If they're quite handy than that. You can use the wipes. I just find personally, by the time you have the wipes that come with the tubes, by the time you have it folded out, you nearly have the whole thing dirty because they're folded up so small. The bit of cotton wool, you kind of have a good grip. It's easier to use, and use a piece of cotton wool for each teat. So one for each teat. Don't be using the one piece of cotton wool on all 4 teeth. So if one teeth has a bit of infection, that you're not spreading it around. So paper towel then as well, if you might need to dry off the cows before you go, if they're dirty or that, to wipe them off before you go with the cotton wool. And then some animal marker spray. So that's very handy now if you are going to do some cows with sealer only and some cow with antibiotics. So if you have your list in the parlour, which cow is getting sealer, which cow is getting antibiotic, go down the line and spray your sealer cows blue and your antibiotic cows red, and then put down the paper, and you can focus then on keeping your hands clean, and you know which cows are which treatment they're getting. So just some general points around drying off. So we want to reduce the cow's feed intake to try and reduce the milk yield before they're dried off. As I said, that's very important if you're going with sealer only. So if we clip our cows' tails, then try and keep our cows as clean as possible. You could do that the day before, maybe. Usually after you have them clipped, they're fairly clean for a short while afterwards. Our sealers then, store them somewhere warm. So sometimes you can find it difficult to push the plunger up on the tube, especially if they're out in the cold shed, they're stiffer. So keep them either inside the kitchen or in the house. Don't put them directly in front of the fire, but just somewhere, a warm room, to keep them warm. Do not put them into a bucket of hot water. They're very high risk for that hot water to contaminate the tubes, and you could end up spreading mastitis then to all your cows with contaminated tubes. So if you are trying to warm them up, we'll say quickly on the day, the bucket sealer comes in, you can put that bucket into a bucket of hot water. So don't put the tubes directly into hot water. So you can make kind of bain-marie effect if you want, but do not get the tubes wet. So then drying off the cows, dry them off in small batches, maybe 30 cows at a time. If you have a larger parlour, maybe only let in 10 cows at a time, or 5 cows at a time. So if you let in a big row of, let's say, 16 or 20 cows, by the time you get to that last cow, she's fed up standing there. She said, "What's going on? Let me out." They all get agitated, and then there's just more risk for things to go wrong. So go with small numbers at a time, and keep it simple for yourself and for the cows. So after you've given the tubes, then leave the cows to stand out in the yard for 20 or 30 minutes afterwards. Just don't let them lie down straight away. Try and reduce them picking up an infection at that point. And then if they are going into housing after you've dried them off, ensure that the cubicles are lined and ready to go when you let them in, that you're not going into dirty cubicles. So our dry off procedure then, I suppose this is an image from a magazine, but we kind of do want to be achieving this level of cleanliness. So the gloves are clean, the teeth are clean, her legs are fairly clean, and there's fairly low risk for picking up a new infection at this point. So the dry off procedure, if you are using teeth seal only, the most critical point of when she's going to get an infection is when you're actually inserting that tube. So if it's not this level of cleanliness, when you're putting in that teeth sealer on its own, there's very high risk that that's where she's most likely to pick up the new infection. So it's kind of up to you to do things. One fella said it's like a brain surgery, and it is kind of that level of hygiene that we do need to achieve. So when we're going cleaning our teeth, we want to start with the front teeth first. So we use our cotton wool soaked in methylated spirits or surgical spirits. We start off, if we're standing behind the cow, we're reaching forward and drying off cleaning off the two front teeth first, and then we're coming and doing the rear teeth second. So why are we doing this? This is so we don't come in with reach in with our hand and dirty our back teeth if we're going to trying to reach forward and clean our front ones. So we've cleaned our front ones and now we're cleaning our back ones, and there should be nothing touching those teeth. Then when we're giving our tubes, we start in the opposite direction. So we give our tube to the two back teeth first, and then we go and give the two front ones last with the tubes. So again, that's so you're not dirtying what you've just cleaned. Now, if you are going with an antibiotic tube and then with a sealer tube, you want to do one teeth at a time. So don't go with, say, and put in all 4 antibiotic tubes and then come after and give all 4 teeth seal tubes. Start with the back teeth, give the antibiotic tube, then give the sealer tube. Start with the other back teeth, then antibiotic followed by your sealer. So you're not contaminating, or there's not time in between where they're picking up an infection there. Again, then with our sealer, it's very important to pinch the base of the teeth. So up here where the teeth joins into the other, you want to pinch that and hold the sealer down in the teeth canal. So don't worry if all the tube doesn't fit into the teeth. That's fine. If it ends up coming out a bit, that's really better because it stops any bacteria from getting in that way. So very important to pinch the teeth and hold the sealer down in the teeth. So in summary then, when we're using teeth seal, we want to use our last milk recording to select cows within 30 days of drying off, using a cell count of 65,000 or less. So the lower the better, basically here. Our milk yield wants to be under 15 kg per day or under 15 litres per day in the lead up to drying off. If not, trying to restrict our cows feeding to try and get that under. So we're also picking our younger lactation cows who are second and third lactation cows, not our first lactation cows. I think that the risk is a good bit higher with those. And we also want to be looking at our early calving cows, so cows with a dry period of 60 to 80 days, definitely not our late calving cows. And then finally our housing and our cubicles. We're regularly cleaning them. Our scrapers are running. Any other kind of passageways where there's no scrapers, that we're keeping that clean as well. So that's kind of the summary there. We've contact details there for myself, Ronan, or Paddy, our milk quality advisors. Again, at this time of year, it's good to look at our dry cow minerals. So Michael Murphy there is a nutritionist. If you want to talk to him, maybe look at your silage results and see what you need mineral-wise for those. So if you are having a problem with your cell count, you're not at 200,000 bulk tank yet. So Animal Health Ireland do these cell check solutions programs, so you can sign up to those, and your local vet can go through what you could do to improve your mastitis and cell count in your herds. So that's it. Yeah, thank you very much. I hope that was helpful. So yeah, give us a call or a shout if there is any questions, or you want to go through milk recordings or anything like that. Give us a call. Thank you.